All right. Thank you, everybody, for joining us for this part 3 of our 3-part webinar series. It's our final one for the year, and so we're looking forward to sharing this content with you. Just a brief introduction this time, because I think a lot of you have joined us previously, but my name is Paul Sewell. I'm the National Sales Manager for Laser Anaesthetics, and I look after the LPG endermologie range, bulimia, macroexfoliation, 2-ender LED, as well as a laser system for varicose veins. I've been in the pharmaceutical business for a long time. I joined Endotherapeutics a number of years ago, had a stint in dental implants, and then came back to join the business in the capacity that I'm in today. I have a real passion for LPG endermologie, given the fact that it is a technology that's been around for over 30 years. So it is something that's been tried and tested, and it's well documented and evidenced. So it is a great technology. I'll introduce Maria for her, just because that's probably going to be easier. But Maria joins us from sunny Queensland. Maria spent over 15 years with LPG endermologie. She's a trained physiotherapist, originally trained in France. In Spain. Sorry, Maria, in Spain, and then had worked in France in rehabilitation centres and private clinics where LPG endermologie was being used, and that then led her to jump across into the corporate world, and where she became a trainer for LPG endermologie, going as far as being an international trainer for LPG. Thankfully, she landed in Australia, and now she works with us as our expert trainer, and she's certainly very passionate about LPG, really knows her material. So aside from these training sessions, Maria is always available to book for some training, or to even to reach out with, personally. Follow her on Instagram. I think she follows a lot of you on Instagram and Facebook. So thank you, Maria, for joining us and being one of our hosts today.
Thank you, Paul.
I've also got Faith Littlewood, who's online today. I haven't got a special slide for her, but Faith is our territory manager for Queensland, but she's also helping us look after WA and SA at the moment. So Faith is looking after all the 3 products in the portfolio, so LPG, bulimia, and 2-ender LED. So please feel free to reach out to Faith at any time. You can either contact me directly or contact our customer service, but we'll also share Faith's details at the end of the webinar. Just in terms of what we'll aim to cover off today, this is our poor circulation and fluid mobilization webinar. Basically, it's 2 topics because we're actually demonstrating the 2 machines. So the last webinar that we did, so the session 1 was done predominantly on the Alliance system. Today's one we'll do partly on the Integral system and then partly on the Alliance, just to give a bit of extra benefit to those that actually have the Integral system at the moment. LPG have written protocols up for the new system, so there'll be a little bit more information on the new system, which we'll share at the end. Just in terms of what I'll aim to cover off today, we'll cover off the causes and symptoms of fluid retention, and I'll just briefly mention lymphatic drainage and the lymphatic system itself. We'll cover off the causes and symptoms of poor circulation. I'll talk about how LPG endermologie fits in. I'll talk about what causes fluid retention, how LPG can help, and then we'll go over the protocols, and then we'll finish with a practical demonstration with Maria. Just in terms of the topic, basically there's 2 broad categories if we're talking about fluid retention, and that's generalized edema or localized edema. And so basically generalized edema, that's where swelling occurs throughout the body, whereas localized edema is where particular parts of the body are affected. And I'll just put a caution note here, because if edema and swelling can actually be symptomatic of a serious medical condition. So it's just important for any of your clients or patients to consult their doctor or their specialist before starting a treatment, and also just be alert to any unusual changes. So if, for instance, throughout the course of treatment, the person's complaining of pain in a certain part of the body, or there's excess swelling or something in a certain part of the body that wasn't there before, I think it's important to just be aware of those changes and then consult, again, their healthcare practitioner. Just in terms of the lymphatic system, because this is ultimately a big part of what's behind this discussion. But basically, the lymphatic system is another system in the body that's very similar to the vascular system. However, it's designed to collect the fluid that drains and leaks out of our tissue. So fluid regularly leaks from the blood into the surrounding tissue. The leakage is normally managed by the lymphatic system. So under normal circumstances, our lymphatic system's functioning normally. We're not even aware of that drainage happening, but basically the lymphatic system's collecting all that fluid leakage normally. As the fluid leaks, it begins to accumulate in different parts of the body, and it's picked up and removed by the lymphatic vessels. This drainage of the lymphatic system prevents edema and maintains normal blood volume. So normal functioning of the human body, people won't even know the lymphatic system's operating. You won't have any swelling. It's just doing its job. The lymphatic system, like the veins, is made up of tributaries, so very small vessels, and this is where the lymph fluid is actually picked up from. The lymph vessels themselves have got very thin walls and have valves to prevent the backflow of fluid. However, the biggest difference between the lymphatic system and the vascular system is that there's no actual physical pump to move the fluid along. In the venous system, you've actually got the heart generating the pressure that helps return the blood back to the heart, whereas in the lymphatic system, there's no actual pump. So the system actually relies on skeletal muscle, respiratory movement, and contraction of the smooth butt muscle in the vessel walls to actually help return the fluids. And that's why lymphatic drainage can actually be impeded when people have got something like very dense fibrous cellulite, because the muscle is not able to create that contraction around the lymphatic vessels to help the fluid return back to the rest of the body. Just in terms of fluid retention and what are some of the causes and symptoms? Well, the symptoms are generally swelling of the affected body parts. So generally it's the extremities, so the feet, ankles and hands, aching of the affected area, stiff joints, unexplained weight gain, and skin changes upon touching. And that's where I think Maria does a brief demonstration ahead of the webinar today just on doing an assessment. And that's where touch and feel is really important in this regard when you're conducting an assessment, particularly when it relates to things like fluid retention and poor circulation, because you will be able to see changes in the tissue upon pressing the tissue in. Some of the causes of gravity, so people who are obviously standing on their feet all day, all our nurses, all of you guys who are operating, providing treatments if you're on your feet all day, the fluid has a tendency to pool in the extremities. Hot weather, so the body is less efficient at moving fluid during the hot summer months. Burns, hormonal changes, pregnancy. We've discussed that in our first webinar, but definitely pregnancy is a big cause of fluid retention. Different medications, dietary deficiencies, and then also chronic conditions such as venous insufficiency, so varicose veins. Some of the medical causes of fluid retention. This is why it's actually quite a complex space and why it's important to consult with a medical practitioner. But you've got things like kidney disease, heart failure, chronic lung diseases, liver disease, thyroid, arthritis, allergic reactions, and autoimmune diseases. So it's this long list is not there to scare you off, conducting some of these protocols. It's just more to make you aware that there are serious medical conditions that can influence fluid retention and poor circulation. And so therefore it's important to, consult the medical practitioner prior to starting treatment. Some of the other medical causes, you've got malignant lymphedema, and this is where the actual lymph vessels themselves are blocked, where you've got women who have had a mastectomy, where it involves the removal of the associated lymph nodes or damage to the lymph nodes. You'll actually then have the lymphatic system, the drainage being impeded. I did a little bit of research, and basically a recent meta-analysis estimated that the incidence of chronic arm edema, following breast cancer can be as high as 21%. But the actual diagnostic criteria isn't clear or well documented. So the actual incidence could be as much as high as 50%. So it is quite prevalent. And so a lot of women who have had a mastectomy will report of fluid retention or edema in the associated limbs. Onto poor circulation and some of the symptoms, but basically there are a wide range of symptoms, but the main ones that I note here are numbness and tingling in the hands and feet. I just put a note here about Raynaud's disease, which I'll cover off in a minute, but basically that's a slightly different condition that also causes numbness and tinglings in the extremities. Cold hands and feet, swelling in the feet and ankles and legs, joint and muscle cramping, skin color changes, ulcers in the legs or feet, and varicose veins. And actually varicose veins, as they progress, and get worse, they actually lead to more and more skin changes to the point where you'll start to get staining of the skin, and then you'll actually end up getting venous leg ulcers. In terms of poor circulation and the symptoms, some of the symptoms are swelling in the lower extremities and varicose veins. So poor circulation and varicose veins can cause pooling of fluid in the lower extremities. As I said earlier, the resulting edema can lead to a gradual change in the characteristics of the skin. And if it's poorly managed, basically in its most extreme presentation, it does lead to venous leg ulcers. And that's why the most common intervention for something like varicose veins is a venous leg procedure, something like a laser or radiofrequency, because ultimately that person has got venous insufficiency, their valves aren't working effectively anymore, the blood's pooling in their extremities, and that condition is not going to improve unless they actually have a varicose vein procedure. The edema in the extremities can also be a sign of heart failure. So this is why it's important to contextualize the age of your client, and just, again, I don't want to keep emphasizing this too much, but just have them consult their GP or specialist. And so it's more likely, obviously, to affect your older clients, but it's just something to be aware of. Some of the other causes are things like atherosclerosis, so high cholesterol, and clots, diabetes mellitus, blood clots. So basically that causes restriction in the vessels and the return of the blood back to the heart. And they can develop any part of the body. And that's, again, why it's important just to be cautious when dealing with poor circulation, that you are eliminating some of these other causes. Being overweight, and this is why it's quite related to LPG endermology and just the formation of cellulite and the progression of things like cellulite over time, and the differences in cellulite. So hormonal, very dense fibrous cellulite will actually really impede the return of lymphatic or just venous fluid. So losing weight or having your cellulite managed is a really important part of improving circulation. And then, as I said earlier, an unusual condition which affects approximately 1-2% of adults annually is just this disease called Raynaud's disease or Raynaud's phenomenon. You actually get basically a restriction of blood flow to the extremities. So it can affect the fingers, the ears, the knees, and the nipples. And generally, it's caused by spasm of the blood vessels in the area concerned. So you can actually treat something like Raynaud's disease with LPG. So you could use the very small treatment head, so one of the face treatment heads for the hands, just to improve the circulation to the extremities. It would be something certainly you could address. Some of the solutions for poor circulation are losing weight and quitting smoking. We all should be aware by now that smoking does affect the peripheral circulation. Dietary improvements, wearing compression stockings, that helps to manage pain and swelling. Increase in exercise, even a daily walk can help. So whilst for some people who are carrying excess weight, or they've got maybe something like lymphedema, it might be difficult, but just some sort of movement. So even if it's not a daily walk, some sort of exercise while sitting down, so lifting their legs up and down. You can get sit down cycle machines, but also as we're here for LPG endermology, can certainly help with poor circulation. Just the last couple of slides are just about how can LPG help. So this was a great picture I found in one of the papers I was reading. But basically what it's showing is that LPG is effectively a vacuum pressure device. And so through the application of the treatment head, mechanical action is converted to a biological response. So with the current TH80 treatment head in the Alliance system, what you've got is a roll and a flap. And the combination of the roll, the flap, and then suction is creating a fold of skin and fat that's drawn up into the treatment head chamber, and actually works to create a pressure differential or a roll. And so as you move the treatment head over the body, that roll is moved along, and that's helping to create pressure differentials. It's helping to deeply stimulate or massage the tissue more than, say, manual therapy. And that's why some of the work that's been done comparing LPG to manual therapy has shown that LPG is superior to manual therapy, just simply because it has the deeper action. One of the papers I read that was quite interesting was one from 1990, which is a paper by Watson, and this paper is available on the LPG medical site, COSURE. So if you're interested, you can request it from us or you can read it yourself. But basically, LPG, this paper just described 3 of the main actions of what LPG does in relation to fluid retention and poor circulation. One of the findings, and they did this through using laser Doppler, it showed a dramatic increase in skin perfusion. And so this is why, you know, one of the reported changes from LPG is the brightness of the skin, better circulation of the skin. There's, for the face protocols, there's actually skin brightening protocols. But basically, it showed a 4 to 5 increase from baseline. It peaked at 6 to 10 minutes post-treatment, but the actual perfusion in the tissue was elevated for more than 6 hours after treatment. So it had quite a long-lasting, profound change in just cutaneous blood flow and the skin perfusion. A similar color flow Doppler. This is using Doppler ultrasound. I'm pretty sure the device they use here, but basically it showed a venous flow velocity increase. So it showed a velocity in the lower extremity veins of 2 to 3 times as compared to baseline. This peak occurred at 8 to 10 minutes post endermology again. However, it showed a prolonged change that went beyond 6 hours. And then in terms of lymphatic flow, it basically, so I'm blocking half my slides here, whoops. So this paper described a 3 times increase in lymphatic flow when compared to the untreated limbs. They did a compared 2 limbs, so 1 untreated and 1 treated. The effects were observed as early as 30 minutes after the endermology treatment, but the most dramatic changes were actually more than 3 hours after endermology. And what's been described in by other authors, Professor Pillar from Flinders University in South Australia, described that endermology or vacuum therapy devices actually create a pressure differential, and that's basically helping the fluid move from an area of low pressure to high pressure to low pressure. So you're helping to move the lymphatic fluids throughout the lymphatic system. That's it from my section. So I'm going to step across shortly into Maria's demonstration, where she's going to actually go through each of the steps. We've filmed them prior to this. Just want to quickly make you aware of, again, a thank you special we have for attending the webinar. So we're providing 25% off all retail and pro LPG cosmetics and nutricosmetics. So if you can write down or note this coupon code, Fluid25. This deal is valid until Monday 29th. So please note that down and order up, ready for Christmas. As I said earlier, Maria is available for any trainings, so we can provide one-on-one mentoring. We are looking to book some group sessions, so I'm most likely looking to try to do something early next year, either from our training centre in Sydney or other places. You can book refresher trainings, but yeah, basically just contact us anytime to organise any extra training that you need after this event. And so that's it from my section. So I think my timing's just on. So over to Maria, to you to give us the demonstration.
Thank you, Paul. So welcome again to the webinar. So today we're going to talk a little bit different from the pregnancy edema and swelling that we can have with our customers. So the fluid management is giving us another dimension of the treatment. So we go a little bit further from the beauty. And I'm going to show you 2 different cases. So one of my customers is a very young girl, 26 years old, actually. So she consulted the first time for Cellulite, right? We can have it here. Can you pause it, Bernie, please? So this is my customer. She came, Maria, I'm very concerned about my cellulite. What can I do? And we'll say, come here to my clinic. We are going to do an assessment. And then from that, we will talk about what's the best protocol we are going to suggest to you. So, well, when I checked the cellulite, actually, it was very early stage of cellulites. So I will say just grade 1. That's mean the cellulites appear when we're pressing, we compress the skin, and then you can see a little bit of the cellulite. At 26 years old, it's quite very early to start developing the cellulite, but once we start to talk, and she told me that she's complaining already about having pain in the legs. Then my alarm come up and said, what's going on here? So we, apart from the cellulite, we need to take care as well of any signs of fluids in the body. So we have 2 or 3 manners to know if we have any edema, actually. So the first one we call Godet sign. This actually, when we press the skin for 2 or 3 seconds, when we remove it, the sign is positive when the finger, if we remove the fingers, and then we can see the print on the skin. So this print on the skin can be really quick to disappear, or can be actually very slow. So we need to count actually the seconds that the skin takes to come back to normal. That's the Godet sign. So if this sign is positive, means that we have some swollen and some kind of edema in the legs, for instance. So that's something that I do normally, even if we are treating cellulite. It's a natural just to do and to check if something else behind, especially when she told me that she's experiencing some calf pain during the day. Then I ask more questions about how the swelling is, if you have more volume change during the days, or if it is more related to the period or menstruations, for example. And she told me, no, I have that all the time. I'm working very crazy hours. She's studying cooking, and so she studied during the day, and then during the afternoon and until very late, she's working. So I stand up many hours. And that's another sign of the edema as well. So when you have the swollen retention, the Godet sign is positive, you have some pain there, we need to ask a little bit further. So I asked her, did you consult a doctor and talk about that? And say, yes, I consult a specialist because I have this pain since I was 22 and nothing showed up. So then we know that she's very active girl, but she's not doing any exercise. So that's make a difference. Paul was telling us that the lymphatic system is actually not working as the vein system. The pump are not as powerful as the veins. So that actually creates an extravasation of liquid. So that's mean you have a swollen in the legs. And if you are not doing exercise and you're not having any rest, sometimes you can have pain because of that. And that just came from the body assessment, one single test that is taking a few seconds. So I really recommend you to do. I have a question here, I think. Paul, do I have any questions regarding that?
Sorry, I was on mute. How long did you say the fingerprint would stay to indicate retention?
So we have 3 seconds pressing. When we remove it, we count. So if it's coming up in less than 2 seconds or 3 seconds, then it's fine. And it's taking longer than 3 seconds, then we have the Godet sign is positive. And actually you can see, because you are going to have a hole on the arm, on the area you're pressing it. Sometimes you can have a positive test on the foot, but not in the knee area or on the legs, and you can have it on one hand and not to the other. The location of this positive sign is giving us some ideas if we have another medical condition. So that's why if you detect a Godet sign, it's really important to make her consult with the doctor to check the cardiovascular system and to check everything that is correct, and then we are okay to do the treatments. So in her case, in particular, she has degree 1 of cellulites, so only appearing when it's pressing. The Godet sign, it wasn't positive, but she still has some pain on the legs. And the second test I'm gonna do is to see if she has some fluids around the legs. So Bernie, can you press and now again the video? So she's checking the cellulite. I can see the cellulite when it's pressing. This is the flick test, second. And then the third is the Godet sign. Can you pause it again? Thank you. So the assessment it goes really fast. It's just a few seconds to test these 3 things. The flick test actually is when you are pushing the skin in very light way. You can see actually the skin is moving. So if you have some fluids, you actually can see the waves. in her case, she was very wobbly, and you can see a lot of fluids on the legs. It's not noticeable on the video, but that's one of the tests that you need to know, because if you have some swelling, actually we need to take care with endermology, and that's going to help us to plan the treatments. So the flick test was positive, the Godet was negative. You can see the skin change a little bit, coming white. So it's very slow reacting to the natural pressure, but she was fine. Why I did a fluid mobilization treatment on her, it's because in a state one of cellulite with a lot of fluids around, we need to remove these fluids, kickstart the lymphatic system to work properly. And from that, when the fluid is gone, then we can work more deeply on the cellulite. Okay. Just keep moving now. If you have any question about the assessment, just let me know. So I'm pressing again a few seconds and come back. So the step one on fluid mobilization is activating the abdominal area. In this case, because a lot of people ask us how we do the fluid mobilization with the integral device, I'm doing it with the integral, this first patient, and then the second one will be with the Allianz demonstration. So actually here, we have a frequency and the motion of the rollers moving in through the roll up, and that's mean that we allow a little bit of movement in the abdomen area. It's very pleasant treatment as well. I always double check with her how she feels. And you can check as well, I'm pressing my buttons to change the direction of the rollers. So I'm not forcing the head all the time. So I'm going back and forwards into the abdominal area, stimulating the inguinal and abdominal lymph nodes. Okay. The fluid mobilization, it's important as we're starting any kind of beauty treatment, because while we have a healthy system, the fat reduction and the cellulite will move faster. Because her being very young and doesn't have a very stuck cellulite, it's allowed me to work more in the lymphatic system. So I explained to her as well that if we're gonna improve her condition, it's something apart from the endermology treatment that we can do. It's, for example, I say to her wearing compression panties while she's working more than 3 or 4 hours in a row without resting. Of course, exercise needs to be a important part of the treatment. So having a good diet, doing exercise, but also doing cold showers is going to help. And when you are resting, have elevated limbs, so the legs can drain the fluid to the heart and to the dummy. So if we're doing any exercise after the endermology treatment, that's going to boost our powerful circulation effects. So with endermology, we increase circulation by 3 times. So if we add this exercise just next to the treatment, that's going to allow us to improve and to get really good results. So now we're doing the legs. We have this maneuver of back and forward with the head. So I'm changing the direction at all the time. I'm arriving to the end and coming back. And that's very simple treatment to do. So I invite it, if you never use it, or sometimes you don't think about doing those treatments, I really push you to do it and to see how fast you get the result of on cellulite, for example. So ideally, when you have a good assessment, you are able to get the best protocols for your customers. So make sure that you don't forget anything about the inflammation and signs, and you include on your assessment all these 3 tests. From the cellulite part of it related with the swelling, remember that we have 3 kinds of cellulite. We have cellulite related with the water retention. We have the cellulite related with the fat, and we just have the pure cellulite. So when in the assessment process, if you press and you can't see, and you can see any sign of liquid, then you just go directly for a cellulite treatment with no problem. But if you find any sign of fluids, I will recommend to do 2 to 3 treatments of fluid management could be poor circulation of fluid mobilization prior to our beauty treatments.
That was a question that Julie just asked. I think you answered the question. So it was, how many of these treatments would you do before starting working on cellulite?
So I just say, so it's normally 2 to 3 treatments, but really depends on how our customers are reacting to it. If our customers are working, sitting many hours, lack of mobility, and poor diet, of course, we will need a little bit more than 2 and 3. Everyone who is doing endermologie knows the power of the lymphatic. So when we do those treatments, the elimination of fluids is quite fast. Sometimes can come overnight, just straight after the first treatment. Sometimes can take a good week, 2 or 3 treatments to get it active. So if you do a treatment in someone like my customers, she's young, so everything we do, she noticed straight away. So we did this fluid management treatment, and she went to the toilets straight after. You can see that the improvement is going to be fast. Other people who just do a couple of weeks of treatment and you don't have any kind of reactions, you need to question her. Can you pause this, please? No, just keep going. So we need to ask her about the diet, the alcohol intake, and what kind of food is taking, if you have any food intolerance, and if they are having any medication as well. If sometimes you have the medical condition as well, so make sure that you are not taking any blood thinners, because you can have this kind of swelling associated to those medications. But if everything is clear and the GP said that it's all healthy, you should have a result really fast.
Question, so can their cellulite look worse once we start removing fluid?
Definitely yes, and that's something that we always talk about on the training. Remember that if we have a fluid layer, that's going to cover our cellulite. So it's essential to ask them, and if you notice that you have the fluids and you can't really see the cellulite, you just need to tell them after a couple of sessions, while the fluids are moving around, you will see actually a cellulite. The cellulite appear even worse than it used to be. And that's actually a good sign. And it's very welcome when they already know that. If you give them this information a little bit late or while it's happening, they will call you very anxiously. Maria, I think it's not working. This treatment is not working. I have more cellulite. That's not normal. While if you do take this time to talk about the cellulite and the fluids while you're doing the assessment and just playing, that after a few sessions, the cellulite will appear worse, but it's actually a good sign, because then we can attack directly to the problem. And that's when we normally swap to the regular programs for cellulite. So it's a really good question, Julie, thanks. I think I have another question.
If they only have localized swelling, do we still need to do a fluid retention treatment?
I recommend to do it because that's going to accelerate the process. Of course, you can do only one section, and my next customer, you will see some knee pain with a little bit of swelling on the knee. So it's maybe talking about what you're asking. I still doing the full body drainage, because it's not only for the fluid, but it's actually working on the way that everything is the cells are gonna react. So the fat cells are gonna be in better condition to react. The septa are gonna be more prepared as well, more stretchable, and that's allow us to work better and faster. So sometimes it's worth it to spend a couple of sessions on the fluid mobilization and then go for the beauty. Yes, I normally do that. So we are in the step 5 of the fluid mobilization. Is the feet. It's really gentle and very good massage. It's very pleasant. So customer normally they do love that. Sometimes we lose the suction on the plantar area. Doesn't really matter. So what is going to stimulate here, it's more the rolling motions back and forward into the feet. And the last steps is applying the leg light moisturizer. Can you post this, Bernadette? Thank you. So just talking about the cosmetic that I normally use for those fluid mobilization conditions and heavy legs, a little bit of the swollen and discomfort. This product is actually very good because it has 7% of LPG toning complex, which is really active, and have two main ingredients that I want to talk about you quickly. So one is the Palmaria palmata extract. It's actually a seaweed that is working in activating the microvessels. And then we have Sempervirens seed extract. So they are both plants or algae that apply to the skin, actually have this vasoconstrictor effect. So you feel released straight away after using it. So when you have, now that the summer is coming, very hot weather, humid weather, you suffer from these heavy legs, it's the product to sell them as well. Because if you have it on your handbag, you can apply every time. If you have a short or skirt, it's easy to apply, very refreshing. And it's actually getting this immediate relief. So it's something that I normally propose on those patients. Even though she's really young, she's complaining about pain. So I always take care of more her comfort and well-being, more than her cellulite side. And after we did 6 sessions, the cellulite is coming back to 1 actually. So no cellulite appearance at all.
I've just got a quick question from Elena. What she's asking is, do you start with, so any of your cellulite treatments, you start with a fluid retention part for clients that have got a swollen body. So I think what Elena's asking is you'd start off with a fluid retention protocol before you start working on the cellulite, or you'd be suggesting, Maria, that you do the fluid retention for the first few sessions and then you move on to the cellulite?
We can do both, and especially with the interval device, we have 2 protocols. So we have cellulite treatments and we have cellulite and fluids as well. And then we have just fluids. So when you do the assessment, actually it's depends of the quantity of the fluids, how you feel. I mean, this is more of the practice skill. So if you find that it's really heavy fluids and it's impeding that the cellulite is gonna work better, I will choose the fluid mobilization only. If it is someone like her, for example, I could choose as well the cellulite and fluids combining. It's a good, program to target the cellulite and the fluids. I could use this one for her as well, but I did want to show you the process of thinking how or which program I'm going to use for them. So all 3 possibilities are good, but taking care of fluids and cellulite together, and I will start with this one and then just go for cellulite if your cellulite disappear very fast after the sessions. Okay.
Okay, thanks.
So now I'm applying the leg moisturizer. So it's just a few flicks over the legs. Bernie, you can start again. Thank you. You do one side, the other side, and that's done. Very easy cosmetic to use. So the next study case, we're using the LPG endermologie Cellulite M6 Alliance. We describe poor circulation. And in this particular case, my customer is a little bit older than the previous one. She's 56. She does exercise and she consulted because she said, I'm feeling heavy, Maria. I think it's getting hot and I always have this swollen retention. And actually I injured my knee, so my knee is hurting. So I did again these 3 tests, the God sign, the flicking test, the cellulite as well. And then I asked her a few questions about the pain, how the pain is going, when you do feel the discomfort on the legs. It was more at the end of the day when she's working or walking too much. So this poor circulation is more when you have, the bloody abdomen area as well, and you can feel the age of the person. She's not draining properly. She has maybe not the best food ever. So I said poor circulation is gonna help her to boost the circulation first. So she will feel a little bit more active as well. And she told me that she's going to go for diet as well and moving more. And this poor circulation is gonna help me in the injuries as well. So for her knee, actually she consulted the doctor, she says it's not really major injury, must be arthritis that she have. And sometimes it's getting really swollen around the knee. And because of this swelling, I noticed as well this fat pocket around the knee. So Allianz, you know that no matter what we're doing, we activate the circulation, we treat the lymphatics, we're working on the cellulite and also on the fat cells. So this poor circulation is actually really good for her to start with. She wasn't really interested in the beauty treatments. And I say, if you want to release the pain and you want to feel lighter and feel much better, have better sleep, this poor circulation is going to help you with this. So the Allianz is already automatic in the way that we propose the treatment. So we started in the abdomen as well, very similar to the intraoral device. We always double check with her, how does it feel, if has any pain spots, and we just relax and do the treatments. Any question about here?
No, but I was just going to say how nice that to end the LED system looks in the background there. Maria, you're very lucky to have one.
Actually, I use it for her as well right after, because you know the programs, some of them can take inflammation and
yes.
pain. So for the knee and some arthritis problems or feet or hands, sometimes I use it as well. So even it's a face treatment and face interface, it can be easily put it on the knees, and she just love it. So now we're going to the knee. So the way that the circulatory process is going to be active, it's very similar as the programs that we normally do for beauty, right? You can see, I can't see here if I'm doing cellulite or if I'm doing fluids retention. What's make the difference is not the way or where we're going, it's gonna be the settings on the device. But because it's a really good device, we don't think about that anymore because all the settings are preset. The setting, the frequency, and the speed of the flap and the roller are really designed to get the maximum effect on the circulatory problems, like these women. So apparently we're doing kind of the same treatment, but it's actually not. Have you tried these treatments before normally?
That's the skin identity sensor, isn't it, Maria? That's where the treatment head automatically adjusts to the, based on your assessment, the settings you've put into the program you've selected.
No, this sensor is actually once we're doing the beauty programs, when we select the kind of skin that we take in, so it's dense skin or fibrosis or adipose, then it's gonna regulate the assessment. When we do the poor circulation, it's a program that is already preset for the skin condition, and all the settings become automatic. Okay, so the skin's intelligent skin sensor is gonna be more effective or more used when we're doing the fat reduction, the cellulite, and the skin toning combining. So then he can really react to all these three kind of skin textures. I was laughing with her because she just loved it. What else we can do about any swelling? If you have an injury like right knee for her, it's other kind of program that you can use, but the fluid mobilization for circulation, it's making a good effect on that. Because when you have the inflammation, the blood vessels are gonna activate and are very permeable. So that's gonna facilitate the swelling and the infection and the traumatic area. So if you have a pain in any joint, it can be also lower back, it can be the ankle, it can be the wrist. So if your customer are coming and complaining about something like this kind of pains, don't say to them, oh, you know, I can't do anything. It says endermology react in this kind of medical, not very, they react really well to this medical condition as well. So while we're doing the cellulite, the fat, we also can take care of these pains and swellings around the joints without any risk. So we are doing the cuff now. It's sometimes the cuff, you can find it, they are very hard and it's actually painful. So don't hesitate to regulate the intensity and to reduce or to increase regarding the sensibility of the customers. So that's something that I normally do on the spot. So I check with her, how is this going? And if she said that's fine, then I just keep the intensity I'm working with. Sometimes you can find like a secret spot, like, oh, that's so painful, what is going on there? So don't hesitate to reduce the intensity to do the treatment without any pain. Yeah, I think I have a question as well. I can see a little bit of the question, but not the whole thing.
Yeah, what effect do you achieve with this particular client, and how long will it take? And so what was your aim with this client, I suppose, is the question. How long would it take to manage her?
For me, it was to release the pain as soon as possible. So she's not complaining about the heating anymore and this kind of heavy legs at the end of the day and the discomfort. The first one, it was obviously the pain around the knee joint. And it was also reducing and increasing the chance of getting a little bit healthier with the foot and reduce a little bit the weight. So when you combine all these three, getting a few kilos less, that's going to release pressure for the knee. Removing the fluids from the joints is going to release the pain as well. And maintaining a good active veins, pumps, and lymphatic flows, that's going to keep her in the best condition so she can keep going with the exercise. And that's my really goal with her. In terms of time, it's going to really depend on how she puts on the side as well. But I did 3 treatments with her and the pain is already gone. The fluids, a lot of fluid is gone as well on the legs. The tummy, you can see, is a little bit more of the fat. So I'm actually changed to the fat protocol now. So I'm dedicating more time into the inner thigh, tummy, and legs, and the top of the arms. So obviously she's 56, so she's in the menopause area, and she told me, you know what, since a few years already, I'm storing more and more of the fat on my back and the love handles and a little bit of the like I have these horrible wings, Maria, can you help me with that? So she consulted first for the medical condition, but actually that works really quickly, and now we're working on the beauty part. So after the pain is gone and the fluids in the leg is much better, we can concentrate on the beauty, and that's actually going to improve her medical condition as well with the maintaining sessions, okay? So now her goals change from the first 2 weeks when she consult, and that's the power of the assessment. So when you do an assessment, you write a plan, you set out your goals, and you follow until you get it clear. And once this goal is attained, you can move forward and set up new goals as well for the customer. Thank you, Elena, for the question. Really good question too.
Has she been satisfied so far, Maria, with the treatment?
Oh, yeah. Yes,
I know it's a loaded question, but I mean, what has she described? Obviously, you said that she's got.
I know she's sending me on the neighborhood. She's a neighbor actually, so she came for something, and then she discovered I was doing the treatment, and she, I can't, and complaining about these things. She came for the treatments, and now I have half of the neighborhood here.
That's a good problem to have.
Customer. And this for circulation, you can see as well the amount of relaxation you provide during the treatment. It's not only, treating your health condition, but it's also providing relaxation and some good moment for them. Maybe they don't have the opportunity to relax as much, and they were expecting maybe a painful treatment, and it's actually not. So when we're working on the back, it's because of the lymph nodes are located in different parts, and we have a good large change around the hips, and it's connected to the back. And that's why the endermology is doing right now.
I've just got a question.
Yes.
So how do you work on a little bit of localized fluid and cellulite in one session with the alliance? You mentioned you could do that with the integral.
Two ways. You can use your beauty programs to do that, the poor circulation, but just sorting up some of the steps. So you just remove a few steps and you cut up on time. Or you could use the fluid mobilization on the medical problem. So if you go to the health menu, we have some fluid as well, and that will be more of the localized areas.
So a question from Elena is, and I think this might be related to probably fluid. Are you able to predict how many sessions you would require to treat the client? What is a safe number of sessions to inform the client at first session?
That's a good question as well, and depends if it's really more of the well-being treatments or it's more of the I want this target objective, get it done as soon as possible. Okay, so I will program as any endermology program, because what we need is consistency. It's not about to do it 2 weeks, a lot of fluid mobilization and then stop it. Sometimes it's more about the constancy and to be regular with the treatment that is going to help in long term to get the result as well. With the fluids, it's amazing because it normally works really fast. So after maybe 3-4 sessions, sometimes less, sometimes a little bit more, the fluids has tended to go away. Of course, we need to understand the cause of these fluids. It's because of the heat, it's because you had the menstruation, it's because some people just eat a little bit of gluten, like bread or cheese bread and alcohol, and that's enough to create a little bit of inflammation around your gut, and that produce a fluid retention as well. So depends really on the origin of the fluids. If you have an injury and then you do a couple of segments, areas around the knee, and then the fluid is gone, then you don't need to come back and do it again. Once the fluid is gone because of the injury, then it's gone. Doesn't really matter. If you are pregnant, after the pregnancy, the fluids will move away. So that's another reason why we start the treatments. If you are having varicose veins, circulation problems, and more of the genetic condition, really bad circulation, then you should maintain these treatments over the time. And don't forget that if you stop the treatment, the results, at what moment you will lose it. So it's better maintaining once a month regularly, and you will improve and get even better results than just do 2 months of treatment and then none. So really the cause is gonna give you the answer to that, and also the lifestyles of your customer.
I can also comment on that based on, like, particularly, as you said, if there is a more serious underlying medical condition, it's probably not going to resolve itself until that is addressed. And so with someone like varicose veins, really a surgical intervention is probably what's required at some point would that be right, Maria?
Yeah, regarding the medical condition, something I will be really, really aware of, it's if this swelling is coming just one part of the right arm or right legs, because that's a heart failure. So depends on the age of the customer as well, and the kind of medication they got. But if you see something really like you don't understand, and you see, oh, that's maybe too much, or why one area, one leg and not the other, it's always good to consult the doctors, because it's not really good to do an endermology, poor circulation in case of heart failure. And sometimes we are not very familiar with these symptoms or signs. So if you have swelling, it's always prudent to check with the doctor if we are going to do that. If it has no main medical condition, normally the swelling is coming from both legs or both arms. It's more of the regular uniform swelling. When we have this kind of medical condition, it's more of only one leg or only one arm, and it's actually quite big as well. So on those cases, I will consider medical advice and not doing any endermology treatments. Good. We are doing the back of the legs. Sometimes she wasn't having any spider veins, but it's something that when doing the poor circulation program we were aware of. So if you have a thick, big spider veins, then we need to go around. Remember, it's a local contraindication. We still can do the treatment, that's fine, but we will draw maybe on the wetsuit a circle, so that's reminder to don't go over there, and we respect those spots because that can dilate the veins a little bit more because of the suction.
Just a question, varicose veins, anything we should be aware from? Most of the aged clients have that, how to treat them.
Yeah, varicose veins, normally we move around. That generally improves the condition of the varicose veins because the circulatory system is going to improve, and that's actually good for the spider veins, for the light veins. But if you have really ugly and thick and spider vein, that's what you go around. Okay, so varicose, it's very common. That's come from the statics, and the bloods go a little bit away, and that's why you can see it. It's part of the local contraindication, so we move around. But if we are very light on the intensity, we still can go through that, and that will improve as well. Another thing about the veins, some people get vein surgery, so we need to wait 2 months after the surgery. Okay.
So Julie's just asking, you can go over spider veins. I think you were saying only very lightly, either avoid the area or go very lightly.
Spider veins, we remove, we just don't go over the area. Okay, especially if they are very ugly and thick and big. In the varicose vein, it's fine if we go into the low intensity. And I finished this program as well with the Lyme moisturizer, and I could also use the Draining Detox serum cream, which is really good for circulation as well. So yeah, the time is going so fast. It's already 12:30. So if you have more questions, don't hesitate to come back to us. I hope that you enjoy this webinar that Endotherapeutics and Paul are organizing, and probably see you next year, early next year in Sydney, right?
Yeah, so I hope I'm on. Yeah, I'm so thank you, Maria. That was really informative. And look, the idea of these sessions was just to keep the information going. Obviously, we've all had different moments of lockdown, and so we haven't been able to provide that face-to-face training or those group-based training sessions. But yeah, the idea of this was to just get the questions going. And so if you have got questions after these webinars, feel free to forward them through. You can send them through to me, and then I can collate them and send them to Maria, and then we can get them back to you. But we will be looking to host some group-based training sessions next year as a starting point. We are attending a lot of the major events, so non-surgical symposium, beauty expo, there's a plastics meeting. So associated with those events, we'll also possibly look to host some training sessions. So, but as always, just feel free to contact us anytime. We have got some Black Friday specials as well. We've got the special, obviously the discount from today. We also have sent out notifications, I think today on Black Friday. So look out for those. We've got Wellbox on promotion for our clients, which is the best price we've probably ever offered. And so if you have any clients you want to sell a Wellbox to, you could actually look to purchase them yourselves from us and then on-sell them to your client, or purchase them yourselves. So that's a wholesale price to our valuable customers. But thank you again, Maria. If anyone's got any questions after the webinar, as I said, just feel free to send me an email, and we look forward to hosting future events in the future.